Arthritis neck pain relief. Is it possible to get pain relief if you have arthritis? Well, stay tuned and I'll give you a case example and explain how it works. Hey, I'm Dr. Ekberg with Wellness for Life, and if you'd like to truly master health by understanding how the body really works, make sure that you subscribe and hit that notification bell so that we can keep this content coming your way. I can't tell you the number of people that come through the office who have some sort of pain, and the first thing that they tell me is they went to the doctor and they had x-rays and they were told that they have arthritis and that there's probably nothing that can be done about it. But they're desperate, so we're their last hope, their last option. Well, sadly, we are their last option. We should be their first option, because if we could address that long before it became a big problem, then that arthritis would be much less likely to develop. But what is arthritis? Arthritis is bony degeneration. When that joint isn't working properly, then it starts to get some inflammation, and the body tries to create increased stability by laying down more bone. A joint that's working properly has a very fine-tuned muscle control. So a joint can only move and work as well as the muscles that are stabilizing and moving it. And of course, it's the brain that moves the muscles. And if there's any distortion in the feedback between the joint and the brain, then the brain can't control it properly. It becomes a little unstable, and over time it wears unevenly, it gets inflamed, it doesn't repair properly, it has uneven weight bearing, and so on and on and on. And over a period of years or decades, we develop bony degeneration and arthritis. So most people over 50 would probably find some arthritis on their spine if they had an x-ray. But that's not the cause of the pain, it's a result of a dysfunction. And the pain and the arthritis are the result of the same dysfunction. It's not that one is causing the other. If we can improve the function, typically we can improve the quality of life, the stability, the range of motion, etc. So I had this lady come in recently. She is 65-ish, and she could turn her head about 45 degrees to the right, and she could turn about 10 degrees to the left. And she said it was very difficult to drive, because if she was supposed to look over her left shoulder at all, she had to kind of twist and move her whole body. And I've had hundreds of people that tell me that exact story. So not only is there personal suffering involved, but you can only imagine what it does for traffic safety if people can't look over their shoulder. So long story short, we adjusted her a few times, and 2 weeks later, she has completely normal range of motion. She can turn 80 degrees to the left, she can turn 80 degrees to the right, which is a normal rotational range of motion. So she had been told that because they found arthritis, that was the cause of her limited motion. And they told her this would never get better, get used to it, take some pain pills, etc., etc. But just because there is arthritis on the x-ray doesn't mean that that's the cause of anything. It doesn't mean that the function can't be improved. Your body is designed to heal, your body is designed to self-correct and manage things if we can just help it along, if we can get rid of some of the interference, if we can provide it better feedback, better signals, if we can give the brain a truer picture of what the world looks like, your body will go right on to healing and performing and functioning, no matter how long it's been. Are there cases of arthritis that are truly causing stiffness and limitations? Of course. There is a point where that arthritis causes fusion, and if all the joints in the neck fuse, then you have no rotation. Then we can't do much for that range of motion. We can still improve the function and reduce whatever pain. We can improve signaling and help the quality of life. But there is always a limitation of matter For most people, they have a lot more left in them than they believe because they've never had anyone truly help the body along and figure out what's interfering and reconnect everything to where it's working properly. If you have some arthritis, if you've been told that you have it, if you have been told to get surgery, let me know what your experiences are. If you know someone who has that kind of situation, write your questions, write your comments. I'll be more than happy to try to get back to it and see if I can address some of it. If you're new to this channel and you enjoy this sort of content, make sure that you hit the subscribe button and the notification bell so that we can keep this content coming your way. Thank you so much for watching.